Of all of the psychedelic substances that have been studied and are being used for things like treatment-resistant depression, PTSD, anxiety, and other conditions, ketamine is one of the most interesting, and that's the topic of today's video. So many of us have heard about ketamine. Ketamine is a dissociative psychedelic drug. There's some debate on whether or not it could be considered a psychedelic. Some groups of people consider it a psychedelic, some don't. But for this video, we will consider it a psychedelic. It can be used for pain control. It produces euphoria, intoxication, a whole bunch of other effects that we'll talk about today. It has been studied and is being used for things like treatment-resistant depression, PTSD, anxiety, OCD, but I believe the depression and PTSD are some of the main uses. It is an anesthetic, a pain reliever that can be used in hospitals. It is a well-known veterinary anesthetic. It's very useful for procedures not involving or requiring smooth muscle relaxation. Now, this word dissociative, what does that mean? Well, it produces a sense of dissociation, a separation. It alters the person's sense of time, space, and reality. In certain doses of ketamine, people enter what's called a K-hole, and this is a state of almost complete dissociation coupled with visual and auditory hallucinations. And this is one of the things that makes ketamine very different than other psychedelics. In a low dose ketamine, this can be used for things like trauma, fractures, extremity pain, lower back pain, abdominal pain, and flank pain. So it has a lot of interesting uses, and its effects are very multifaceted, which makes it a very interesting drug to study and to use in treatment of things like depression or pain. So briefly, let's talk about the psychedelic experience. Ketamine is derived from PCP, but it's very different from PCP and DXM. Now, DXM is found in cough medicine. There are some people, for whatever reason, consume a bunch of DXM. You can find this is something like Robitussin. And if you consume enough of it, it does produce a strong dissociation. The thing about ketamine, though, is just very short acting. You can snort it, inject it, or take it orally. Snorting is purely recreational. In a hospital, a research setting, injection or IV is preferred, and it can be taken orally. But from the research I saw from the video on the Huberman lab that I'm going to post in the description, the intravenous method seems to be the one that's the most studied. Now, we mentioned that ketamine is very different than other psychedelics, but it has some similar effects like other psychedelics. Consuming ketamine can produce things like novel experiences or insights, a sense of timelessness, and it can allow you to view life or your perspective from the third person. And psychedelics can be characterized by things like this. Now, what's interesting, I mentioned that it produces dissociation and can be used for pain relief. Now, these two pieces are uncharacteristic of classic psychedelics, especially as used for anesthesia. Ketamine also can increase something called neuroplasticity. This allows for new pathways in the brain that allow for some more flexibility, more avenues of learning. And it's believed that some of this action produces the change in perspective when it comes to treating things like depression, treatment-resistant depression, or PTSD. So let's talk about its use in medicine. From the research I saw, it can be used alone as anesthesia or with another medication. It can be used in the emergency room for short-term sedation. I'm not sure about how much it's used or how often it's used. From the paper that I read that was pretty up-to-date, it mentioned it being used in a hospital setting. It can be used well for bronchospasms, for bronchodilation. It has uses for kids in acute pain situations, 3 months or older. Children also have a very quick metabolism, which is why there's an advantage in using ketamine. A low-dose ketamine or sub-dissociative treatment for pain is an application. This can be used with or without other pain medications, injectable non-steroids or opioids. It is a possible opioid alternative in select scenarios. So it seems like the treatment for pain is very interesting because it's kind of a double-edged sword in a way. Because of the dissociative state at certain doses, it's classified differently than other pain medications or other sedatives. There seems to be a fine line with dosage. I mentioned in my other videos how when we take substances, dosage is very important. And so when it's given, it really has to be a specific dosage and treatment in order to prevent that dissociation. What's interesting, this is not going to be the topic of this video, but there is a nasal spray called Spravato for treatment. It's a ketamine nasal spray. Now, this, from what I researched, is only used in doctors' offices. There's some pretty interesting new developments when it comes to this specific method of delivery. I keep mentioning treatment-resistant depression. Well, it's pretty straightforward. For a lot of people that are very, very depressed, they've gone through the ringer of all sorts of different treatments, from SSRIs to SNRIs to MAOI inhibitors to other treatments, and they have not found relief. Ketamine seems to be a very effective treatment for those who have not found any relief. So let's talk a little bit about that. Ketamine therapy. The mainline treatment for depression, is what's called the monoamine hypothesis. The idea that these neurotransmitters moving in and out of our neurons that regulate mood have a direct effect on things like depression. And so, given this hypothesis, you have these medications like SSRIs, I have a video on those, that are meant to control or regulate the flow of some of those neurotransmitters. The issue with this treatment is that there's only about 40% relief from depression symptoms with these types of drugs, and they come with side effects. In my 2-part series on SSRIs, we talk about how this treatment is very hit or miss. It works for some people, but overall it doesn't really seem to be very effective, and there seems to be, in some cases, more harm than good. And these things take months to work. That's a big piece, because if you're suffering from very intense and very serious depression, you do not want to wait months for relief. You want relief as fast as possible. So I mentioned dosage and route of delivery. So in a clinical setting, injection or IV is pretty much preferred. These are very controlled dosages, and I did mention this nasal spray. In a recreational setting, or in some settings, you're given a prescription and you're allowed to take it at home. This can be a little risky. There's an oral or sublingual treatment, and the availability of the drug in your system is different than the IV or intravenous route. What's nice about ketamine as a therapy is that it has a very broad application. PTSD, treatment-resistant depression, OCD, anxiety, substance use and addiction. A lot of these things are still being researched and studied, but the research does seem to be positive. So there are some dilemmas. The effect is very short-lived, but it's immediate. I mentioned over here that the issue outside of the side effects and the effectiveness for the mainline treatments like SSRIs is that it takes months to work. With ketamine, it's a very immediate effect, and this is a very big positive. If you're someone who suffered from very intense clinical depression for years, and you get some kind of relief, it's a game changer. So now, how do you take this substance and figure out how to deliver it so that it is effective not only in the short term, but the long term? So there have been really interesting studies done. Things have shown that weekly use can offer some relief. Once you dose, the relief does last for a few days after dosing. The issue with weekly use is, okay, how often are you consuming it? Because ketamine can be abused. Just like a lot of substances, you have to be concerned about abuse and being overly dependent. So that is a big concern. In a long-term study, twice a week for 3 weeks with a break, and then repetition produced weeks to months of ongoing relief, and then the cycle starts again. So this shows pretty broad and pretty strong durability. So it's not like you're taking it every day. It's a twice a week dose for a certain amount of time, and there's a break. So it seems like the risk for abuse is lower, and there's weeks to months of relief. Again, this is a game changer, but it's not perfect. So before we get into more of the research and the adverse effects, let's talk about how it works. The Huberman lab video goes a lot deeper into it. He's a neuroscientist. He knows his stuff way better than I do. So a lot of this video is taking some of what he presented. So the mechanism of action, we talked about this relief, days to weeks to months. It changes the way the brain processes information. Neuroplasticity. So neuroplasticity allows for the brain to establish new connections and new avenues for learning and all sorts of other things. This receptor, the NMDA receptor, allows the neurons to modify and establish new connections, open up new highways, new roads. And ketamine crosses what's called the blood-brain barrier. This barrier that keeps unwanted stuff out the brain, ketamine crosses it, and it really loves to connect to these receptors. So if we go up here, these receptors are responsible for learned adaptations and neuroplasticity. So in our body, we have this balance between excitation and inhibition. You have this molecule glutamate that binds and causes an excitation, and you'll have this molecule GABA that binds and causes inhibition. Now this balance is what's responsible for the moment-to-moment functioning, especially when it comes to the brain. And ketamine will connect to this receptor to produce an excitation, a more stimulated response. And when ketamine connects to this NMDA receptor and causes an excitation, there's some other things that happen. It causes a short and long-term change in things like mood. And mood seems to be regulated by the enhancement of excitation, synaptogenesis, new connections in the synapses of the brain. And this also can result in these days to weeks long changes and benefits of ketamine. We also have something called brain-derived neurotrophic factor, BDNF, that also results in plasticity, cell repair, and protection. When ketamine is broken down, a metabolite or a product that results from this substance being broken down is hydroxynorketamine, HNK. Now, this is interesting because HNK is a mu opioid receptor. In my videos on opioids, we talked about the mu receptor. This is where opioids connect to and the physiological effects of opioids sprout from. What's interesting about HNK is that it actually has to bind to relieve depression. There's a study done to block this receptor to see if ketamine still produced the same effect. And it was found that this metabolite has to connect. It needs to connect to this mu receptor to help relieve depression. And so the whole point here is that the subjective experience, the psychedelic experience, is not really required, which is interesting because for a lot of psychedelics, that experience is a big part of the change in the way someone might see the world or see the condition that they have, like depression or something like that. And again, the Huberman Lab video goes much deeper and gets more specific than what I just mentioned. This is just a very general overview. So there's some really interesting research that's been done. There's a lot of papers. I just saw a few. So in a study with 25 patients, male patients who are drug-free, who had no psychosis, head injuries, or anything like that, after 2 weeks to a month, there was significant reduction in symptoms after being treated with ketamine. In the American Journal of Psychiatry for chronic PTSD, 30 patients were treated with ketamine versus midazolam, and there showed significant improvement in those who took ketamine. In a Harvard study with 403 patients, 55% sustained improvement. Now, this was IV, as I mentioned before. But again, we're seeing some improvement in this case, depression. So the research is constantly changing and evolving. I want to mention, though, just like anything, this doesn't work for everyone. It's not a one-size-fits-all. Ketamine, some people swear by it. For some people, it never works. But for those who have found relief, they find it very, very helpful and they swear by it. Which is why you do see this being a factor in some psychiatric practices, because some physicians have found it to be very helpful. Okay, so the adverse effects. So allergic effects can be facial, lip, tongue, and throat swelling. Gastrointestinal side effects like nausea and vomiting. Neurological side effects like seizures. Psychiatric side effects: confusion, fear, anxiety, delirium, dissociative states, hallucinations. Just like any substance, there are goods and there are bads. There's ups and there's downs. Because biology is so complex and everyone is different, people are going to respond differently. Now, dependence and addiction with prolonged use is a big factor. Withdrawal is another big factor. People have died from ketamine. Ketamine is not a perfectly safe substance. Some more issues: kidney failure, hydronephrosis, urinary tract infections. One piece that wasn't mentioned in the Huberman lab, someone actually commented, is this thing called ketamine bladder. It's actually pretty big in the UK and other places. If you're constantly taking ketamine, it can actually really damage your bladder, the bladder muscles, the bladder wall. This can cause things like urgency, frequency, pain, incontinence. About 20 to 30% of consistent ketamine users have ketamine bladder. Very, very interesting condition. So let's go back and review what we learned. We talked about how ketamine is this dissociative psychedelic drug that can be used for depression, PTSD, and it offers a bunch of different effects outside of the relief: pain control, dissociation, which is very interesting, and in low doses it can be used for all sorts of emergent situations. People who take ketamine can experience novel experiences, timelessness, looking at their life from the third person. We talked about this thing called neuroplasticity. We also mentioned how the dissociation and pain relief part of ketamine is very different and not characteristic of other psychedelics. So it can be considered a psychedelic, but it's a little bit different compared to others. We then talked about its use for things like pain management in low doses. It can be used by itself or combined with a myriad of other medications, but because of this dissociation it can produce, it is classified differently than other sedatives. We then spoke about ketamine therapy, the mainline treatment for depression being things like SSRIs, SNRIs. And while sometimes they help, we talked about how they're not really that helpful and they take a while to work, whereas ketamine is a pretty immediate reliever of symptoms. We spoke about the dosages in clinical settings, the intravenous routes, in other settings, the oral routes. It has a very broad application for all sorts of conditions. But while it does have immediate effects, there needs to be considerations with things like dependency and abuse. And with certain types of therapy schedules, there can be weeks to months of relief. We then briefly talked about the NMDA receptor, how there's these different molecules that connect with it, and ketamine being one of them. It allows for things like neuroplasticity, these openings of new pathways and new connections in the brain. We then spoke about the short and long-term changes, the changes in mood, the development of new synapses, these changes that can last from days to weeks. And then we talked about hydroxynorketamine, how it connects to this opioid receptor, the mu opioid receptor, and it actually needs to bind in order to relieve the depression, which means that this subjective psychedelic experience is not required. This is very different than other psychedelics. We then got into some of the research. Overall, we spoke about how it seems to have a pretty good effect on those who suffer from things like depression or PTSD. The research is constantly changing. And evolving. It doesn't work for everyone, but for those whom it works for, it works very well. Then we closed out with the adverse effects, things like gastrointestinal effects, neurological effects, psychiatric effects. There is a heavy concern for dependence, addiction, and abuse. It is abused a lot recreationally. Death can occur. We talked about ketamine bladder, this very interesting side effect that a decent amount of consistent ketamine users can suffer from. Overall, while ketamine does have its benefits, there are risks and there are things that need to be considered when it comes to treatment. So that's all I got. I hope you guys learned a lot. This video was really interesting for me to make. And my apologies for not posting for a few weeks. Life's been busy, I've been moving, but I'm back on the regular schedule. And as I mentioned before, please watch the Huberman Lab video. It will go into much more depth than I did, but I hope this did give you some education on this very interesting drug. As always, thank you so much for watching and listening. Tell your friends, and I'll be back soon with another video.